if dementia suddenly gets worse, don't assume it's the dementia. It really could be a UTI. And I learned this the hard way myself with my mum, because she would regularly get UTIs. There were times that I noticed it because when she suddenly become very confused, more confused than she normally is. She couldn't settle at night, or she behaved in ways that were just completely unlike her. And that's initially my first thought was always that, oh, the dementia has taken a turn. But no, in some cases it wasn't. It was a fact that she had a UTI. So in this video, I want to show you what a UTI can actually look like in someone with dementia, and also to share some of the things that I learned that you can use to help you spot the signs and, know what to do with that, basically, when you know that something isn't right. And stay with me, because at the end, I'm going to give you a little simple tool, basically, that you can use when this happens, so you can remember what to do when somebody potentially may have a UTI. And I've turned it into a little simple checklist that you can download, and it's free in the description box down below. So, what does a UTI actually look like in someone with dementia? If you've had a UTI, you probably experience, burning when you go to the toilet, needing the toilet more often, having cloudy urine or urine that smells stronger than normal. But somebody with dementia may have those symptoms, but may not express them or realize they do. They might just look uncomfortable, or they'll feel uncomfortable but not know what it is. And what you might notice instead is that they suddenly are very different from what they might normally be. More confused. They might become more anxious or more agitated or more repetitive or restless. And they might be calling out at night time. My mum went through this, where she was seeing and hearing things more as a result of the UTI. Or they might be going completely the other way. And this is surprising, I think. They might become very quiet, very withdrawn, barely responding, or just seem to disappear within themselves. You might also notice that they're off their food, that there's a change in their toileting or their urine, and maybe they have a temperature, or they could just generally just feel unwell. They don't need to have all of those symptoms. This is really not about looking for one perfect UTI symptom. It's really about noticing that something has suddenly changed, and that's the key word, suddenly changed. And there's another reason why UTIs can be so difficult to spot in someone with dementia, and that's delirium. A UTI can trigger something called delirium, a sudden change in confusion and awareness and behaviour caused by something going on in their body. And delirium can look very different from one person to the next. This really surprised me, how a UTI could look so different from one episode to another. I never realised. And that's because of how delirium presents itself. There are two different types, actually three if you mix them. There's hyperactive delirium, where someone becomes restless, agitated, anxious, repetitive, calling out to you, or even, seeing and hearing things that aren't there. That's the one that most people expect to see or know, basically. And then there is the hypoactive delirium, which can be much harder to spot. Someone might suddenly become, very quiet, very sleepy, withdrawn, barely responding to you, or just completely absent from themselves. I saw that a lot with my mum, that she just kind of withdrew, and I knew that there was something wrong. And you can have a mixture of the two as well, where someone can be very quiet in the morning or during the daytime, and then incredibly agitated in the evening. So you might actually dismiss it as some form of sundowning, because you know that exists. And that's what happened with my mum at different times. But eventually you start to feel that there's something wrong. And it's important to recognise, because a UTI can turn a behaviour either up or down. And with all of these different symptoms, how do you actually know what you're looking at? For me, the biggest clue was never one particular symptom. It was just how quickly mum had changed. Like I said, suddenly was the key. If someone was roughly the same yesterday and today they're suddenly very agitated or confused or withdrawn or just completely different from themselves, how they are normally, that's the word I would use. What is their normal? That's what I wouldn't ignore, because dementia does progress. Yes, it does progress, but it happens gradually. It's not a sudden change. It's different with a UTI. So instead of immediately asking, has the dementia got worse? Ask yourself, what's changed so suddenly? And so then one of the things you're going to need to consider is a UTI. If it's a sudden change, that should make you stop and investigate. And that's when knowing what's normal for your loved one becomes really important, because you know your loved one best. You know how they normally talk. You know how they normally behave during the day. You know what their triggers are, and you know what can create an anxiety attack, or when they're unusually chatty or quiet, whether they normally sleep through the night or whether they sleep during the day. That's what you need to recognize, whether what you think is a good day or bad day is actually a UTI. So you might walk into the room and not be able to explain exactly, what's wrong, but something in you is saying, this isn't them. This is not them. You don't need to know what's wrong to know that there's something wrong. But there's another part of this that I've learned the hard way. Sometimes you notice a change and you call the doctor and it gets put down to, oh no, it's fine. It's just the dementia progressing. You don't need to worry. It's just the dementia progressing. And it just annoys me. So instead of just saying she's become more confused, be specific. Say, this is a sudden change from her normal. This started yesterday. She normally behaves like this, and now she's doing this. Be specific about what's changed and when it changed, because you're not telling the doctor it definitely is a UTI. You're telling them that this is not their normal and you want to know what's causing it. It needs to be investigated. Whatever happens, don't just tell them that they're worse. Tell them what's changed, what's different. And the reason I wouldn't leave this and just wait to see what happens is the delirium can get worse if the underlying cause isn't treated. And that can mean more confusion, a greater risk of falls, and potentially a hospital stay. And if it's the infection itself can become much worse. It can affect the kidneys and it could potentially lead to something called sepsis. You don't need to panic every time your loved one has a bad day, but if there's a sudden change from what their normal is, get it checked. Don't wait, get it checked. And if they're deteriorating quickly, they become very drowsy or difficult to wake or develop a fever or start vomiting, then don't wait for a routine appointment. Contact your emergency services and get urgent medical help. So we covered quite a lot here today. Talked about what the changes are that you can look for and the difference between hyperactive and hypoactive and hyperactive delirium, and why the sudden change matters and what to say when to get help. Here's a little tool for you. Think sudden. S is for sudden change. U is for unusual for them. D is don't assume it's the dementia. D, describe what has changed. E, explore the cause. And then N, it needs to get checked. So, you don't need to remember every possible symptom. Just remember sudden. If they're suddenly different from their normal, just don't assume it's a dementia has progressed. Describe what's changed and get it checked. And I've put the sudden framework into a free downloadable checklist for you, so you can keep it somewhere handy rather than trying to remember this. And there's a link below in the description box of this video. And if you found this at all helpful, then please give me a like and a subscribe. And my name is Kat. I cared for my mum with Alzheimer's for over 13 years. And I think once you've spotted a UTI and you've gone through it a couple of times and got it checked, The next question is usually, how do I stop this happening again? And that's what my next video is going to be about. Preventing UTIs in someone with dementia, how to reduce the risks. And I've put it on the screen for you up there.